Hello, this is Debra Leonard. I'm Chair and Professor of Pathology and Laboratory Medicine at the Larner College of Medicine at the University of Vermont and at the University of Vermont Health Network. I have no conflicts of interest with the content of the presentation. I have 30 minutes for covering a 500-year history and a 40-year journey for myself. I will be discussing topics that may evoke many feelings in listeners, especially if you have not heard information like this before, so please be open to exploring your feelings. These are the topics that I will cover today, and we will begin with a definition of race, which is groups of people who have differences and similarities in biological traits deemed by society to be socially significant. And in the course of the talk, we will explore three phrases in this definition: groups of people, differences and similarities in biological traits, and deemed by society to be socially significant. So how was race first defined by scientists? It was actually Linnaeus that first used the terminology of race, and it was defined in his work called Systema Naturae that was revised 12 times over the course of his lifetime. And in this work, he basically created a classification system of genus and species that we use today that is used to categorize all of nature into three kingdoms: mineral, vegetable, and animal. And the significant contribution of Linnaeus is that he included man in the animal kingdom. In the first 9 editions of his Systema Naturae, Linnaeus defined 4 species of man based on continence and skin color. And the skin color is interesting because the contemporary view of scientists at that time period, and shared by Linnaeus, is that skin color was largely a product of climate, as variable as height and weight. In the 10th edition, Linnaeus added additional characterization of the species of man based on not just skin color, but also other physical traits, behavior, manner of clothing, and form of government. And in doing this, Linnaeus classified man into a hierarchy, not just defining differences, but actually a hierarchical system. And you can read the different characteristics. Linnaeus, in his lecture notes and in the various editions of this publication, would change around Americanus, Europaeus, and Asiaticus species of man. Africanus was always the bottom category of man. So what about genetics and race? Well, in our definition of race, differences and similarities in biological traits is certainly determined by genetics. Many genes are actually shared across species, so if we go beyond man, even we share 50% of our genes with a banana. And when you compare human to human genomic differences, there is only about a 0.1% difference between individual human genomes. So across this 0.1% difference between humans, these differences have been categorized with 38 million single nucleotide polymorphisms, which are single base changes in the nucleic acid sequence, about 1.4 million insertions and deletions, and 14,000 larger chromosomal types of deletions or changes. And these have been categorized across different groups of individuals. And these genetic differences, insertions, deletions, copy number variants, inversions, are used to determine ancestry. And so you can see here an example of the 4 races that were defined by Linnaeus back in the 1700s, still are used today to categorize individuals by their ancestry. And what has more recently been found is that genetic differences are about comparable whether you are looking at the genetic differences between different populations of individuals or within populations. So if we think about the differences and similarities in biological traits, what are the socially significant biological physical traits? Well, back to Linnaeus, skin, hair, and eye color were the physical traits that he characterized. And certainly if we look at human skin and hair color, this is an adaptive, continuously variable, multigenic genetic trait. So it is genetically determined. Darker colored skin better protects against negative effects of UV light exposure, and so darker skin colors are seen in the equatorial regions of the world. And lighter colored skin absorbs vitamin D 6 times more efficiently than darker colored skin. And low vitamin D causes bone pain, muscle weakness, cognitive impairment, and other debilities. Lighter colored skin is a survival advantage in colder, darker climates to absorb more vitamin D when there is less sunshine. And eye color, too, is genetically determined. And we understand the genetics of this and the single nucleotide polymorphisms that determine eye color. So all of this variation in the appearance, I've talked about hair and skin and eye color, our nose shape, our lip size, the shape of our face, all of this is genetically determined. So the wide range of biological traits that are used to define race are definitely determined by genomic variations. But race only occurs when those biological traits are given social significance and used for a power hierarchy. I will also note that genomic variation causes disease and disease risks. Those genetic variations generally are not the ones that are used to identify ancestry or to define race. So what is the history of race? And so we will now look at deemed by society to be socially significant, the physical traits determined by genetics used by society to create hierarchy and power structure. So what social significance have these physical traits been given over centuries? So in 1455, we'll go way back, the Roman Catholic Church granted colonization rights of West Africa to Portugal and the New World to Spain. Queen Isabella sponsored Christopher Columbus to go to the New World and decided that Native Americans discovered in the New World or met in the New World would not be enslaved but would be seen as Spanish subjects. But Spain did authorize shipment of captive Africans captured by Portugal transported to the Spanish colonies in the Americas. And over the course of the centuries, 12.5 million African men, women, and children were enslaved. Of those 12.5 million, 26% were children, often children being preferred because they were smaller and didn't take up as much room on the ships. In 1662, before the United States was even formed, a Virginia law declared that all children born in the New World shall be held bond or free only according to the condition of the mother, meaning whether they were of African origin and dark-skinned or white and of Spanish or other white origin. In 1740, the Negro Act in South Carolina criminalized assembly, education, and travel of enslaved individuals, who were from Africa. In 1776, the colonists achieved freedom from the British and established the United States, and in that process maintained slavery. In 1799, Pennsylvania, New York, and New Jersey laws declared that enslaved children born after July 4th, 1799 were legally free at 25 years of age for women and 28 years of age for men, basically allowing enslavement during the most productive years of individuals. In 1808, the U.S. Congress passed the Act prohibiting importation of slaves. However, this did not address domestic slave trade of enslaved black people already in the U.S. And this led to continued inhumane treatment of enslaved black people, selling, beating, rape, separation of families, lack of education. And this created outrage by abolitionists who worked to make slavery illegal. In 1860, skip a few years, Abraham Lincoln was elected president, and that was in November, and in December, South Carolina seceded from the Union, citing increased hostility of non-slaveholding states to the institution of slavery. So in 1861, the Civil War began, and ending in 1865 with the passage of the 13th Amendment making slavery illegal and ending 246 years of slavery in the United States. Or so was thought. In 1866, the Vagrancy Act basically made unemployment a crime. So all the freed black men who had been enslaved were imprisoned for vagrancy and leased back to plantations, and often received worse treatment because the plantation owners were no longer interested in the well-being of these individuals. In 1877, the Supreme Court ruled that it was legal for states to segregate black and white individuals on modes of transportation, leading to a whole series of Jim Crow laws that created segregation of black and white people, including schools, churches, housing, restrooms, jobs, everything. And in 1896, the Supreme Court ruled that the Jim Crow laws were legal, basically reflecting customs and traditions and preserving public peace and good order. You will note that I have put Jim Crow in quotes because Jim Crow was a derogatory term used to indicate a black man. Skip again a few years, and in 1930, the Federal Housing Administration, or FHA, ruled that incompatible racial groups should not be permitted to live in the same communities. The FHA, 4 years later, also created a risk rating system to determine which neighborhoods were safe investments for federally backed mortgages, with black neighborhoods deemed too risky, and these neighborhoods were marked with red ink on maps, and that's where the terminology redlining comes from, to indicate black neighborhoods where federally funded mortgages could not be obtained. We had World War II, and at the end of World War II, during which black and white soldiers fought for our country, a GI Bill was passed that provided veterans with funds for college, housing, and unemployment insurance. However, these funds were not equally available to white and black veterans. In New York and New Jersey, 67,000 of these mortgages were given to white veterans, where less than 100 were given to black veterans. And in Mississippi, it was even worse, with 3,200 given to white veterans and only 2 to black. In 1948, there was an explosion of housing built across the U.S., and much of that was marked for whites only. There was also a transition of manufacturing jobs from cities to suburbs, and most of those suburbs were for white-only individuals and families. So black people could not live in white neighborhoods and could not get federally insured loans for black neighborhoods, and did not often have cars. Only about 28% of men heads of household had cars during this time period to be able to go from inner city to the suburbs where the jobs had moved to, thus creating a wealth gap and unemployment. In 1954, Brown v. Board of Education the Supreme Court ruled that separate but equal laws were not legal and were struck down. In 1956, just 2 years later, the Southern Manifesto was developed to maintain Jim Crow laws in the southern states. All of this led to the 1960s civil rights protests and anti-war protests, which led to a law and order rhetoric. So by 1968, 81% of Americans thought law and order had broken down in the United States, with the majority blaming communists and Negroes who start riots. By 1970, unemployment, drug use, and crime had increased in black neighborhoods. In 1971, Nixon began the war on drugs, framing drug use as a crime rather than a medical condition. And 10 years later, Reagan increased anti-drug budgets of the DOD from $33 million to over $1 billion, and the DEA from $86 million to over $1 billion. In 1986, the Anti-Drug Abuse Act was passed with higher mandatory minimum sentences, basically 5 years minimum sentence replacing a 1-year maximum sentence, and greater sentencing terms for crack cocaine use that was more used by blacks than powder cocaine, which was more used by whites, mandatory evictions from public housing after sentencing, eliminated benefits including student loans. In 1993, Clinton policies cut public housing by $17 billion and increased prison funding by $19 billion, leading to a huge increase in the building and funding of prisons. In 1997 to 99, militarization of the police began, with Pentagon filling 3.4 million orders to more than 11,000 police agencies for aircraft, M16 rifles, grenade launchers, and other military equipment. So by 2006, the lifetime risk of a white man going to prison was 1 in 106, compared to a black man, which was 1 in 14. And for younger black men, the lifetime risk was actually 1 in 9. In 2020, the prison population had increased from 41,000 in 1980 to over 500,000 in 2020 for drug crimes, with 80% of those for possessing drugs, not selling drugs. So what has all this history been on the impact on race and people of color? So the impact on the black race is that they have generally lower paying jobs with less retirement and health insurance. Fewer are homeowners. They have lower financial security and actually have about 10% of the wealth of white households. They have higher rates of arrest and incarceration, less access to high quality education, less access to high quality health care, and higher chronic disease and mortality. So the lived experience for black individuals in the United States is that they experience bias in daily life when interacting with whites. They're followed in stores, they get less desirable seating in restaurants, housing discrimination, and mortgages that are unattainable, less likely to be called back when they are applying for a job. They teach their sons how to stay safe, meaning alive, if interacting with the police. And they learn to code switch so that they can appear more white to white individuals, more acceptable to white individuals, and the list goes on and on. But race is not just black and white. And the experiences of these youth basically indicate that the white individuals create the norms for our society against which everyone else is measured. So what about medicine and race? Well, Black race does impact health. Social racial categories in general have biological effects. Black mothers are 3 to 4 times more likely to die compared to white mothers. Black newborns are twice as likely to die compared to white newborns. And the life expectancy for a Black man is 7 years lower than for any other race. Being Black in America is associated with higher stress levels. And as we all know from our prior year experience with COVID-19, stress definitely impacts health. Our brain, cardiovascular system, immune system, gut, reproductive system. So it is observed that Black individuals have higher blood pressure than white individuals, and this is for both men and women. So why do Black people have hypertension more than white people? Well, if you take cardiovascular disease as a group, coronary heart disease, heart failure, heart attack, stroke, and peripheral artery disease, the risk factors for cardiovascular disease are hypertension, diabetes, high cholesterol, obesity, poor nutrition, inactivity, smoking, and poor sleep. These are often more influenced by economic and social factors than by genetics. So the question is, are higher rates of cardiovascular disease and hypertension in Blacks due to genetics or the impact of racism? So if we try to disentangle race, genetics, and medicine, we have genetic variations that determine physical traits and also can determine health risks and outcomes. Our physical traits also drive much of the social determinants of health: housing, education, income, food access. And while health and healthcare affects about 10% of overall health and well-being of individuals, the social determinants of health are almost 60% a driver for overall health and well-being. So how should we use race in medicine? It's not really genetics, but could race be a proxy for the social determinants of health? So I have focused a great deal on Black racism, race, but what about white culture and white privilege? So it may seem odd that I even talk about a white culture, but it's kind of like a fish in water. The fish doesn't even realize that it is in water. And so white individuals generally do not realize that there is a white culture. And this invisible white culture has various characteristics, particularly individualism, that an individual can determine their own fate, and meritocracy, that the harder you work, the more you will achieve, and these other characteristics are associated with white culture. So white people live in a world of unrecognized privilege and advantage and make the standards by which all non-white people are measured. And this editorial I found interesting. Laurie Lakin Hutcherson is the Good Black News editor-in-chief and is a Harvard graduate. And a friend of hers asked for her opinion, she is Black, on white privilege. And so she wrote a long piece, which is, the link is at the bottom, but some of her writings were interesting. If you have never had a defining moment in your childhood or life where you realize your skin color alone makes other people hate you, you have white privilege. If you've never been on the receiving end of the assumption that when you've achieved something, it's only because it was taken away from a white person who deserved it, that is white privilege. If no one has ever questioned your intellectual capabilities or attendance at an elite institution based solely on your skin color, that is white privilege. And if you have never experienced or considered how damaging it is, was, or could be to grow up without myriad role models and images in school that reflect you in your required reading material or in the mainstream media, that is white privilege. And so what does she say is being asked of white individuals? She says to acknowledge that white privilege does exist, to stand up for fair treatment and justice, to not let jokes or off-color comments by friends, coworkers, or family slide by without challenge, and to continually make an effort to put yourself in someone else's shoes. And that leads us to how do we move forward? So we've talked about differences and similarities in biological traits that are driven by genetics and the societal impact of creating social significance around skin color. And now let's talk about groups of people. That terminology basically attributes group characteristics to the individual, and this allows distancing and stereotyping and racism. So one of the steps we can take is to see every person as unique and approach them without assumptions. Be open to their experiences and ways of doing things, not judging them by white standards. And I would invite you to think about where you are on this spectrum and how you move around in this spectrum depending upon the setting that you're in. Let me just say that raising your awareness is a process, and you will go forward and backward, and racism is not something that is just for white people. Everyone has racist ideations based on the comparison of their group with other groups. But we have to go beyond individual change. The reason diversity, equity, and inclusion training doesn't work is because it's based on the liberal misconception that change starts in individuals. It's much more effective to dismantle the entrenched systems of white, cis, heterosexual, male power structures in institutions. Watch what happens then to inclusion. And this was tweeted by Rupa Maria, who is a physician. So in conclusion, race is definitely not genetically defined. Race does use genetically determined physical traits and gives those traits social significance in order to define race. And race and racism create a power hierarchy maintained by policies and rules that is invisible to the majority white race and negatively impacts every other race. Dismantling racism requires changing racist policies and rules to value all people as individuals. And medicine must disentangle race, genetics, and the social determinants of health that are driven by race to achieve health equity for our patients and a safe, inclusive environment for our healthcare workers and trainees. On this final slide, I've provided you with additional readings that you could do. Some are shorter, some are longer. Personal experience accounts from James Baldwin, Ta-Nehisi Coates, and Wesley Lowery, as well as posts about the history of racism and race in America. A genetics and race article, which basically looks at the intersection of genetics and race and medicine. And then understanding race, racism, and white privilege. A book called White Fragility was quite enlightening to me, and I am now reading How to Be an Anti-Racist. And then one book that I found quite enlightening is written by 3 Black physicians called Pulse of Perseverance. And I highly recommend that to you.